Okay, so we dove into the axial skeleton today, especially the skull. I've made another video introducing and going into some detail about the rib cage and the vertebral column. But I want to take a few minutes with this skull model, and I'm just going to go through the skeletal system handout, okay, the skull lab handout, one by one, and I'm going to show you on one of these colorful models where each of these structures is located, okay? It's the kind of thing that before the lab exam, I'd like you to be able to do yourselves. To take one of these, to take a pointer, and to explain to someone the nasal bone is here. And in fact, to be able to say the right nasal bone is here, and the left nasal bone is here, okay? Remembering that right and left terms are the patient's right and left. So that's really the goal, is for you guys to be able to answer lab question items about these models. There are non-colorful models, that's fine. There are diagrams, that's also fine. There are a lot of ways to learn this stuff. There's a lot of ways to study this. I like these because as I'm teaching it, I can say the yellow bone, the purple bone and stuff, but I'll use some of both, okay, on the exam. Okay, so I'm going to start. First, I'm going to show you about the things that you can see externally, okay? One way to study this, and one way that the book often will break it up, is to say like an interior view, an inferior view, a lateral view. But I'm going to do sort of a global, external look at as many of these as I can. And I'm going to take it apart, and we're going to look at the ethmoid, the vomer, the sphenoid, the palatine bones, and stuff like that. So the frontal bone is here. It's this sort of flesh, peach-colored, yellow-colored forehead bone. Okay, the superior aspect of the orbit is here. Remember, the orbit is the eye socket. So this is the superior aspect of the orbit. Okay, it forms as well the roof of the orbit. Okay. There's no other really distinct markings that I'm going to ask you guys about, except I want to point out as well that we're here. There's this boundary, okay, between the frontal bone anteriorly and the parietal bones posteriorly. It's this yellow-green border. This joint is called a suture. Sutures are joints between the flat bones of the skull. This joint is called the coronal suture, okay? This joint is called the sagittal suture. It follows the planes that we have already learned about, okay? So there's the frontal bone, okay, with the coronal suture. Coronal suture. Parietal bones are green on this model. Okay, they form the sides, most of the side of the skull. Okay, as well as most of the superior and a little of the posterior aspect of the skull. Okay, they're called parietal bones. Parietal refers to a wall. Okay, the word does. So the green on this model is parietal bones. Temporal bones in this model are brown. Okay, they're here. This is the left temporal bone. Okay, the things you can see from the outside are this little small styloid process. Some of the paint has been scraped off this, so it's brown and white. But this pointy process is called the styloid process. It's talking about a stylus, like a feather that you would dip in ink and write with. It's a very fine, pointy, bony process. It's the styloid process. Okay, superior to the styloid process is this opening to this meatus. Okay, this is the external acoustic meatus. Sometimes it's called the external auditory meatus, but it's the same thing. It's this hole here. Okay, it's here. Temporal bone. This process that projects anteriorly in the inferior part of the temporal bone itself is a zygomatic process of the temporal bone. This is the temporal bone. This is a zygomatic process of the temporal bone. Together with the temporal process of the zygomatic bone forms a zygomatic arch. So zygomatic arch probably shouldn't be listed on your list under temporal bone because it's a combination of two different bones makes the structure. Okay, but this is the zygomatic arch. Okay, if you look from a superior view, you see that it forms an arch in a space behind. Okay, what's in the space? Muscle, tendon, nerves, blood vessels. I'll show you later. Process zygomatic arch. Mandibular fossa. Okay, the mandibular fossa of the temporal bone is inferior. It's this structure here. It's where the mandibular condyle sits. The mandibular condyle is the part of the mandible that articulates with the temporal bone. Alright, so if I say, what is the skull bone that the mandible articulates with, or the lower jaw articulates with, the answer is going to be temporal bone. Okay, and this space right there is called the mandibular fossa. Okay. Oh, okay, mastoid process. If you follow the styloid process posteriorly and superiorly, you see this prominent lump or bump here. You can feel it behind your ear as a bony, kind of little bony, but not little, it's a pretty sizable bony lump behind your ear. It's the mastoid process. Okay, inside here there's some sinus spaces called mastoid air cells. Sometimes really horrific ear infections can involve the bone back here, and you can get what's called osteomyelitis of the mastoid. Osteomyelitis is an infection of the bone. You can get mastoid process osteomyelitis from a bad ear infection, and that's a mess. So that's the mastoid process, okay? And again, this is the left side. These structures are also on the right side, but they're kind of mirror image. Okay. From an inferior view, I want to point out a couple of foramen. Okay. Actually, the canals. Actually, the carotid canal in this model is nice. Some of them are not. Some of them are just a dip or a depression, but this one actually has an area that I can put a pointer in and show you. Okay, this is the left-sided carotid canal. Okay, it's where the internal carotid enters the skull to supply the brain. Many of the most common strokes that we hear about are blood clots and plaques that originate in the vessel that passes through this hole, the carotid artery. Okay, on the right side it's here. Okay. Jugular foramen is a little bit difficult to see on this model, but if you go laterally and posteriorly from where the occipital bone and the sphenoid bone join, then you'll see this irregularly shaped jugular foramen. Okay, this is the jugular foramen. This is the jugular foramen. Okay, it's where the jugular vein leaves the skull on the way back to the heart. Okay, it drains the blood from the brain and brings it back to the heart. That's the jugular vein. Occipital bone is blue on this model. Okay, this is an inferior view. This is the occipital bone. Okay, this is the external protuberance. Okay, and the foramen magnum is this large hole. The foramen is a hole, and magnum means large. This is the large hole. What exits the foramen magnum? The brainstem, the spinal cord. Okay, and so these condyles here and here are the occipital condyles that form a joint with the highest, most superior cervical vertebra, the one that we talked about called atlas. Okay, this is the globe that rests on atlas shoulders. That's the occipital bone. Okay, sphenoid, I have to take it apart. Ethmoid, I have to take it apart. Let's look at the maxilla real quick. Okay. Maxillae, M-A-X-I-L-L-A-E, is plural. of maxilla. There are two. Okay, you have a right and a left. Okay, and the maxilla is important because it forms one of three nasal terminates. Nasal terminates are also called nasal conchae, and they are the shelves inside the nasal cavity. They're shelves of bone that project into the nasal cavity and help create turbulence when we breathe air into our nose. And creating turbulence helps to warm the air and humidify the air. And those structures, instead of just being a wide open hole, those structures contribute to that function, which really is an important part of respiration and breathing. So the purple maxilla actually forms the inferior of the three nasal conchae. Okay? It's confusing on these models because it's often a different color. On this model, you can see it as a brown blob right there. Okay, it's medial. It's the medial part of the bone, but it's the lateral part of the cavity. It's that structure right there. Okay. So the maxilla forms the inferior nasal terminate. There is maxillary sinus. If you've ever had pressure or pain, right in here when you have a sinus infection, or if a doctor has ever pressed on you right there, he's trying to palpate for tenderness in the maxillary sinus. Okay, there's a frontal sinus and there's a maxillary sinus. Palatine process. Let me come back to that one, and let me talk to you about the I'll just point out alveolar process will be the areas where the teeth rest in the socket. Okay, alveolar process accommodates teeth. Palatine bones. Palatine bones. I think it might be time to start taking this apart. Let me make sure I do everything on the outside before I do that. But just follow along on the list. I'll go through everything. Zygomatic bones I already showed you. They're gold on this model. Good. I have motion activated lights in this part of the office. Okay. Pain in the butt. Zygomatic bone. Temporal process of the zygomatic bone. Okay. Zygomatic bone forms the lateral aspect, part of the lateral aspect of the orbit. Okay. Nasal bones, okay, are white. They're superior to the opening aperture of the nasal cavity. Okay, these are the white nasal bones. These can definitely be fractured in fights, in car accidents. Nasal bone fractures are pretty common in trauma. The orange, just immediately posterior to that part of the maxilla, is going to be the lacrimal bones. If you look closely, there's a little hole in that bone. Okay, it's called the lacrimal foramen. They're the tunnels for the tear ducts. So lacrimation is crying or tearfulness, and lacrimal bones refer to the bones where the tear ducts empty into the eye, into the orbit. Lacrimal bones, nasal bones. Vomer. Okay, interestingly, I got a weird formatting thing on here. The vomer is a distinct facial bone. Okay, so I know it's under nasals, but the vomer is this orange bone inside the nasal cavity. Okay, it's perpendicular to the floor of the nasal cavity, and it's shaped like a plowshare. Part of the plow that goes into the soil when you're getting ready to plant seeds. That's what the word vomer means, is plowshare. And when I take this apart in a second, I'll show you it's shaped exactly like that part of the plow that goes into the soil. Pretty cool. Oh, mandible. All right, let's look at the mandible. Okay, so sorry, 1 second. No, okay. Sorry, I'm just trying to make sure there's not a meeting here or something. All right, a couple of other things that maybe would be a little more difficult for, or just things that I may like to highlight. I took the zygomatic bones off, and I'm going to try to take out some of these facial bones without taking the whole thing apart. I'm going to have to take the whole thing apart for the sphenoid, but we can start with this. So this is the vomer. Okay, it looks just like a plowshare. It's flat, very thin, shaped like a claw or a bear claw or a plowshare. Okay, that's the vomer. So this is the ethmoid bone. We went through it in class, but let me just go again and make sure that we're all clear on what all these little distinct parts are. Okay, the ethmoid bone sits in the face like this. So this is how you look at it from an anterior view. Okay. This is called the perpendicular plate. Okay, the perpendicular plate is like almost perfectly midline structure. Okay, it's perpendicular to the floor of the nasal cavity. It's perpendicular to the floor that we're sitting on. It's this right here, perpendicular. It's different than the perpendicular plate of the palatine bone, but we'll get to that. Okay, if you follow this bone up, on the superior aspect, there's this really prominent midline ridge. That's called the crista galli. Crista galli, I can't remember exactly what it means, but the translation is literally something like a rooster, like what the thing that the rooster has on its head. Okay, so that's the crista galli. Okay, it's midline, superior, and it's anterior. If you look at the anterior surface of the ethmoid bone, if it's a good model, which this one is okay, see if I can get it focused. You're going to see fine little pinholes just to each side lateral to the midline. And those are pinholes where the first cranial nerve, the olfactory nerve, sends fibers down into the nasal cavity. They receive information, sense of smell, and they transmit that information back to the brain. So the cribriform plate are those, is the area where olfactory nerve fibers pass through. There's a better diagram of it in the book. These models, it's difficult to appreciate. Crista galli, nasal conchae. Oh, alright, so I told you about the nasal conchae with the maxilla. I mentioned there's three. There's a superior, middle, and inferior. The inferior nasal conchae is formed by the maxilla. Okay, you can see it there on the inside of the macula. It's those brown blobs. Okay, it's the inferior nasal conchae or nasal terminate. The superior and middle are formed by this ethmoid bone. Okay, and it's a little difficult to appreciate on these models, but I just want you to see that there's a superior and an inferior shelf. It's also called a turbinate. It's also called a concha or concha. Anyway, it's the shelves, and the superior and middle are formed by the ethmoid bone, and the inferior is formed by the maxilla. And there's definitely a question in there for sure, a test question in there. Lateral masses refer to this. Call it everything else. Okay, the lateral bulk of this bone on each side. Okay, that's the ethmoid bone. We need to do. I'm going to try to figure out if a picture would be easier than taking this whole apart. Painful. Sorry. Oh wait. Let's crack this baby open. Alright. So definitely one of my favorites. Okay, sphenoid bone. Sorry, let me tip this back out. One of my favorites, sphenoid bone. Okay, the Batman bone, right? The butterfly bone. This is what it looks like from an anterior view. Okay. Posterior view. One of the easiest ways to orient yourself on this bone to anterior and posterior and superior, inferior is going to be this structure here. It's called the sella turcica. Okay. Sella turcica is this depression. Okay. It's posterior and it's superior, and it's where the pituitary gland sits. So this is how the sphenoid bone sits in my face, like this actually. And if you rotate it forward, you're going to see the sella turcica. If you look at a posterior view, you've got a pretty good view of it as well. Okay, that's the sella turcica. The greater and lesser wings, greater and lesser wings, greater wing, lesser wing. I think that the book might show this a little bit, a little better than me on this model. Sella turcica. Okay, this is an anterior view once again. This and this are called the pterygoid processes. Okay, each have a medial and lateral plate. Medial, lateral, and this is a pterygoid process. It's inferior, and it's, if you're, just lateral to the midline. Okay, pterygoid process. Optic foramen. If you look at this bone from a posterior view, and you look at the sella turcica, and you look superiorly and laterally, there's a very round, small canal. That's the optic canal. And if you look from my view, if you look up and laterally, you'll see this hole. This is the optic canal. Okay? On the right, this is the optic canal on the left. Okay? This is a superior view, anterior, posterior. And I want you to appreciate how this foramen is shaped like an oval. Especially if, you see the dark color of my beard behind it, you can really see this oval shaped foramen. Okay? This is the left, and this is the right. Because this is anterior, this is posterior, and this is superior. Okay? Now from this angle, this is the left, and this is the right. Okay, that's the foramen ovale. Also, recall that this bone has air-filled spaces inside the bone, that if we were able to crack this open and look inside, there are air spaces, and those are called sinuses. Okay, so the ethmoid, the sphenoid, and the maxilla, and the frontal bone all have sinuses. Oh, frick, the mandible. So, in class today, I told the group today that this is the mandibular ramus, and that's incorrect. I was not clear about it. A ramus is the area where a projection is given off that forms an angle. So the ramus is through here. This is something called the coronoid process. Okay. The coronoid process. There's something different called the coracoid process, part of the scapula. This is the coronoid process, and it's this bump, this projection off the mandible. This is the condylar process, or the condyloid process. It's where the mandible articulates with the temporal bone. What else? The body, the angle, more alveolar processes where the teeth sit, body, ramus, condyloid process, coronoid process, angle, alveolar process. That's the mandible. Okay. Palatine bone. Palatine bones don't separate from the maxilla on these models, but there is a horizontal plate. Okay, so this is the anterior view. Okay, this is a medial view. This is the floor. This part of this peach-colored palatine bone is a horizontal process. Okay, horizontal plate. This is the perpendicular plate. It's perpendicular to the horizontal process, perpendicular to the floor. Okay, that's the palatine bone. So let me make sure I went through everything here. Temples, occipital. Oh, there's a couple on the inside of the temporal bone. So we talked about the carotid canal and jugular foramen, and I guess the internal acoustic meatus is going to be the only one. The internal acoustic meatus, it would be if you could place a pointer in the external acoustic meatus and push it all the way through the eardrum, the tympanic membrane, and into the skull. It would come out right here. That's the internal acoustic meatus. Maxilla, palatine, zygomatic, lacrimal, nasal, vomer, mandible. So the rest, I think you can review and or study on your own. It's a little bit of a long video, but I really wanted you guys to see, on these models, how I take one apart, how I orient them, how I tell what's superior, interior, and everything like that. Superior and anterior will tell you if part of the bone is a right or a left. Very important to start to recognize those for the test. Okay. Sphenoid bone, there's just one. There's definitely a right and a left side. There's a right pterygoid process, there's a left pterygoid process. And I know that this is the right because I know this is anterior. I know that this is anterior because I know that this is posterior because that's where the sella turcica is. Okay, this is a posterior view. I know it's a posterior view. The sella turcica is there. So I know this is going to be the left pterygoid process. So any which way I hold this, I know what's what. Okay? That's the level of detail and how I want you to be comfortable with these markings and these bones according to the study guide that you have.